Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about subinvolution of uterus. So go ahead, subscribe, and let's get started. Subinvolution of the uterus is when after delivery, the uterus doesn't shrink back to its normal size as quickly as it should. Normally, the uterus gradually goes back to its pre-pregnancy size over a few weeks. But here, that process is slower or delayed. So in simple terms, the uterus is just taking longer than usual to return to normal after childbirth. Now let's see about the causes of subinvolution of the uterus. One common reason is when some parts of the placenta or other products of conception remain inside the uterus after delivery, which prevents it from shrinking properly. Infection, especially endometritis, can also slow down the healing process. Sometimes, the uterine muscles may not contract well, which is called uterine atony, and this can delay involution. In women who have had many pregnancies, known as grand multiparity, the uterus may not return to normal as efficiently. The presence of fibroids can also interfere with normal contraction. In addition, conditions like prolonged labor or overdistension of the uterus, such as in twin pregnancy or excess amniotic fluid, can make it harder for the uterus to shrink back to its usual size. Now, let's see about the clinical features of subinvolution of the uterus. In this condition, the uterus feels larger and softer than what we expect for that particular day after delivery. Normally, it should be firm and gradually reducing in size, but here, that process is delayed. There is also prolonged lochia, especially the red-colored discharge, which continues longer than usual. The mother may experience irregular or excessive vaginal bleeding. Some women may complain of lower abdominal or pelvic pain, and if infection is present, there can be a foul-smelling discharge as well. Now, let's see how we diagnose subinvolution of the uterus. First, it is mainly identified through clinical examination, where the uterus is found to be not reducing in size as expected for the number of days after delivery. The healthcare provider may notice that it is still larger than normal. An ultrasound can also be done to check if there are any retained tissues inside the uterus that might be causing the delay. If there is a suspicion of infection, some tests may be done to check for infection markers as well. Now, let's see about the management of subinvolution of the uterus. The treatment mainly depends on the underlying cause. If the uterus is not contracting well, medications like oxytocin or ergometrin are given to help improve uterine contractions. If there is an infection, antibiotics are prescribed to treat it. In cases where there are retained products inside the uterus, a procedure called evacuation or D&C may be done to remove them. Along with this, general supportive care is also important to help the mother recover properly. So that's all about subinvolution of the uterus. I hope this made the topic clear and easy to understand. Thanks for listening and being a part of the session.